Good afternoon and welcome to the Tompkins County Office for the Aging public hearing for 2021. My name is Karen Bullis and I am the Deputy Director here at the Office for the Aging. And today I am joined by Charlie Hart, who is the Chair of our Advisory Committee. Dawn Sprague is an Aging Services Specialist here in our office. And Lisa Monroe is the Director at the Office for the Aging. So thank you for joining us. Before we begin, I would just like to give a thanks to our County Communications Director, Dominic Recchio, for his time and assistance in helping us bring this hearing to you all virtually. Our public hearing is a chance for us to present to the community our current services and to provide our plan for 2021. You can read the 2022. You can read the 2022 plan abstract through a link that I will put into the chat. It's also available on our website. The hearing also provides us an opportunity to collect feedback from the public regarding our services and our future plan. We are also looking to collect feedback on any issues that are affecting older adults in our community. Again, this year we collected feedback through a brief survey. That survey is still available and we encourage folks to fill that out if they are able. It is available on our website and I will also include that link in the chat. If you're more comfortable, you can certainly give our office a call and a staff person here would be able to collect your answers over the phone. Also throughout today's hearing, you can provide feedback and ask any questions through the chat function. So again, we thank you for joining us today. And without further ado, I'm going to hand it over to Dawn Sprague, who is going to be providing an overview of our services. So if you give me a minute, I will bring up the screen. Good.
Looks good.
Okay, take it away, Dawn.
I think, can you put it where the mission is and I'll start there? Thank you. So, so the mission of our office, Tompkins County Office for the Aging, is to assist older adult persons with long-term care needs to live independently in their homes and their communities with quality of life and dignity. And so now I'm going to tell you about some of our programs. These are our resource booklets that you see on this slide. We have 4 main resource booklets that are full of information and services. They are available at our office. You can stop by and pick them up anytime. Or if you prefer, you can contact our agency and we would be happy to mail them out to you. Okay. So I'm going to talk about some of the services of our office. We do New York Connects, long-term care services. New York Connects is kind of like a first stop for people to get connected with programs and services that they are looking for in the community. Okay. And then Personal Emergency Response System, or what we refer to as PERS, assists individuals who are at risk of falling or other medical emergencies. And it helps them to remain independent and stay in their own homes. An emergency response button is pushed and a designated person or emergency agency is then notified, allowing the individual to get assistance and help. We provide health insurance counseling. This allows us to assist individuals who are new to Medicare or want to discuss their health insurance options. We are able to navigate and educate on Medicare, Medigap supplemental policies, Medicare Advantage plans, prescription drug plans, and Medicare savings plans. We also assist a lot of retirees when they are leaving employment and help them make the best decisions for their insurance needs ongoing. We provide information, referral, and counseling. So we help individuals navigate through the vast community resources that are available in our area. We do this in a person-centered way and in a and in a way that gives them the information and informs them and allows them to make their own decisions on what is best for them, and also assist them in being able to stay in their home. Okay, the Caregivers Resource Center and Alzheimer's Support Unit is located in our agency. You can come and see it. It's in our front lobby. And we provide a caregivers resource library. We offer caregiver training, workshops. We provide a powerful tools for caregivers class that is offered twice a year. And we also offer a weekly caregivers support group and a quarterly newsletter. Project Care Friendly Visiting Program matches an individual in the community with either a community member or a college student, and they provide a weekly friendly visiting visit. We also have another program called the Senior Tablet Project Program, which matches individuals by gifting them a tablet and helps them to learn how to navigate the tablet by setting up an email, downloading an app, and provides them education to be able to attend classes or to visit virtually with friends and family that may not be in the area. And both of these programs are to help alleviate isolation, social isolation, and loneliness. Another thing that we offer along with that is our companion robo-pets, and that also helps alleviate loneliness, especially in homebound people that live alone. Okay. The Home Energy Assistance Program is offered through our agency, and we assist individuals in completing applications and for benefits to assist them with offsetting some of the costs of their heating, utilities, or heating repair and replacement costs. Our long-term care ombudsman program covers Tompkins, Chemung, and Schuyler County, and it provides a voice to residents that reside in long-term care facilities. And the representatives in the program assist in mediating between the long-term care facility and the resident to make sure that their health care plans are followed correctly and to make sure that their rights are being respected. We offer a falls home safety assessment, and that is where someone comes out to the person's home and we do an assessment of fall risk in the home and offer, identify and offer recommendations to rectify those safety issues. Okay. We keep a list of yard work and snow shoveling community members that have been asked to be on the list, and people call our agency and we could provide them with people in their areas and their contact information so that they can set those services up with a person. They are offered either by paying a small fee or by volunteers. The Senior Farmers Market Nutrition Program provides a $20 booklet of coupons, which can be used at any of the local farmers markets to purchase fresh produce and other allowable items. And our Gadabout Transportation Ticket Program provides tickets that allow rides through Gadabout to the Ithaca and surrounding areas. Okay. So our office also contracts with other agencies to provide services, and I'll go over some of those. So that includes FoodNet Meals on Wheels, which are congregate and home delivered meals, offers nutrition counseling and education along with the delivery of the meals. Lifelong offers health insurance counseling, health promotion programs, the Senior Circle newsletter, and multicultural and inclusive programming. Our Tompkins County Long-Term Care Services provides case management and the expanded in-home services for the elderly program, also known as ISEP, and caregiver respite. Ithaca Neighborhood Housing Services assists with the health and safety related home repairs for income eligible seniors. Finger Lakes Independent Center provides a registry program which links individuals needing in-home assistance with independent persons that are for hire. Legal Assistance of Western New York, or Law New York, provides legal assistance in civil matters to some of our individuals. Personal care and chores or housekeeping assistance are provided by some of the following agencies: caregivers, Comfort Keepers, Home Instead, Staff Kings, and Finger Lakes Independent Center Consumer Directed Program. Okay, so I think that is my portion.
Great. Thank you, Dawn. That was a great overview of our services, and that leads us into the information we will talk about for the public hearing. So you'll hear some of those services that Dawn had mentioned here too. But to start off, we're going to provide the links that you see on your screen now here. The public information link right there will be provided in the chat. You can copy that, save it for later so you can review that page. It takes you to a website on our web page on our website. If you can't do that, you can also email Karen Bullis. It's cbullis@tompkins-co.org. And she can put that in the chat too. So that link to the public hearing page on our website includes the link below it, which was the 2020 annual report. It includes the plan abstract that we'll be going through today for 2022. And also it is the brief survey that Karen mentioned in the beginning to have people, there's a Survey Monkey link that people can answer and provide input for us and any feedback that you'd like. And we take all this information and feedback and we adjust our plan accordingly to what the community need is. So, okay, you can go ahead to the next slide, Karen. So again, this plan abstract link that you see on the page, that is on that website page. So you can look at it. It's probably about 10 pages long. So feel free to look through that at any time. So contracts, Dawn did mention the contracts that we have, and we plan on maintaining all our current contracts, assuming that we have the continued availability of funds, that is, which we are pretty sure we do at this point. We have increased one of our full-time equivalent positions to a 0.5, which is a 21-hour-a-week position, to bring back an information aid that we had cut in 2020 because of the COVID cuts that we received. Let's see, this position is approved right now and we're actually currently interviewing for it. So we're excited to get somebody in that position. It would be great. It's the position at our front desk. So it's kind of the first thing people see when they come in, and when they call our office, this person would answer the phone too. So New York Connects program is the next thing. We'll continue. I think Dawn mentioned that we do this program, really provides residents of all ages and with objective and comprehensive information about long-term care services and supports in Tompkins County. And we will continue to do that program. Age Friendly Ithaca and Tompkins and our Center for Excellence. In 2015, the Tompkins County and the city of Ithaca were welcomed into AARP's Age Friendly Network. This is an initiative of the World Health Organization intended to help municipalities prepare for rapid aging. The initiative is designed to help communities and local governments to incorporate healthy, age-friendly principles into policies and programs. So we collaborate with several partners and community organizations to continue implementing these age-friendly initiatives. In 2019, we received a grant. We're one of 3 counties in the state awarded a grant from the Health Foundation of Western and Central New York to support the development of our Age-Friendly Center for Excellence. There's 5 total in New York State. The other 2 were funded through NYSOFA, which is the New York State Office for Aging. It's really to support what New York State Health Across All Policies initiative by promoting age-friendly, the New York State Prevention Agenda, and smart growth planning principles. The primary goal is for us to create livable communities for all ages to support healthy aging by transforming social and physical environments to help support well-being for community members across the lifespan, not just older adults. We do this through, again, collaborating with our partners. We've gotten stakeholder input through many different meetings. In 2022, we continue to plan on working on these goals and tasks and carry them into our next 5-year cycle of age-friendly. Okay, and personal emergency response, another program that Dawn had mentioned. We do contract with Doyle Medical Monitoring to offer our personal emergency response system. The Office for Aging, our outreach staff continue to maintain its involvement with our customer service piece of it. The staff continue to actually install the PERS machines in the clients' homes. In 2022, what we hope to do is expand our new and improved GPS device that's we've gone through a couple different ones, and we were in a good place that we hope to get them out there a little bit more. The technology is working well for us. So we hope to increase people using our PERS, but also increase the GPS devices out there and also continue to get the word out, providing outreach to the community that we do have this program available. The Regional Long-Term Care Ombudsman Program. So the Tompkins County Office for Aging, we're going to continue to cultivate our relationships and our partnerships because we do provide our ombudsman program not only in Tompkins, but in Schuyler and Chemung counties. Currently, we have 2 full-time staff who are certified as ombudsman, a program coordinator, and an outreach and ombudsman program specialist. In 2020, as most people know now, visitations were limited and really not resumed until the second quarter of 2021. So this, exacerbated many of the issues that were already happening in the nursing homes as far as social isolation and loneliness. These people weren't able to see their families or friends. So in 2022, our efforts will really be targeted toward recruiting and training volunteers to get out there to have those visits, advocating for those in-person visits and reestablishing relationships with the facilities and staff and residents there that have changed over time that we weren't allowed to be in those facilities. So addressing social isolation, we'll continue to do that. Dawn mentioned a couple of our programs that we've really begun to really jump into since the COVID pandemic happened. We're always looking for innovative ways to reach people. We did, in the beginning of 2020, we contracted with Senior Planet in OATS, which is Older Adults Technology Services, to run a tablet program that Dawn had mentioned. These participants were matched with students who became their virtual visitor and supported them through the process. We also partnered with Lifelong to provide virtual programming for their members and a tech hotline, a 9 to 5 p.m. tech hotline for Lifelong members to support anyone that was having any issues with their devices, but also our pilot project participants were able to use that hotline too. We recognize that the technology isn't a cure-all, but it's a component of the solution. It's provided access to a virtual world of socialization, information, telehealth opportunities that many of our clients wouldn't have been able to experience. So we'll continue this contract through 2022 and hopefully bring on more people into our tablet program with this support. And also the companion pets, of course, like Dawn said, these were a bigger hit than I ever anticipated, but we do have many pets, and these, we've gotten lots of really great feedback from people, very nice voicemails and notes telling us how much of a difference they've made in people's lives. They really can facilitate some intergenerational connections too for people, stimulate conversation and communication. They help to soothe anxiety, and they can really increase the quality of life for people with or without dementia, but and people that are socially isolated as well. Again, our Caregivers Resource Center, so we will continue that. In 2021, we expanded our caregiver support group to a weekly basis and enhanced our resource materials and library. We'll continue to enhance our support and offerings in 2022. We recently received a grant, a mini grant from the New York State Respite Coalition, Caregiving and Respite Coalition, to provide a grant to loved ones, to caregivers of their loved ones that have Parkinson's disease. We're calling this the Pause for Parkinson's Project. So this grant will continue through 2022. I think it ends in August of 2022, but we'll be providing respite to the care receivers of the people that have Parkinson's. They'll be matched up with students who receive specific training, respite training, as well as some Parkinson's specific training. So they'll be matched, so the care receiver for a few hours to provide respite to the caregiver. So we're working on this, is just getting up and going, and we hope to do this throughout 2022. So policy trends is something that we always have forefront in our mind. We continue to strengthen community options that make it possible for older adults to age well and safely in their homes and communities. The Aging Network does play a pivotal role in addressing the social determinants of health and bridging the gap between acute and long-term care services and supports. The Long-Term Care Committee and our Advisory Committee, which Charlie is our chair, the Office for Aging will continue to monitor the effects of the current policies and legislation on the lives of older adults. This is just an example right now, including the Better Care, Better Jobs Act, which would provide more support to family caregivers and better pay for home health workers as a way to help address the home care shortage, home care worker shortage that we're facing right now. Also, the Older Americans Act modernization and investing into funding for programs and services, recognizing and protecting the role that the Aging Network plays in that, and addressing the social determinants of health to improve health outcomes, racial disparities, promote health equity, reviewing the long-term support system, delivery system, and how populations navigate it really is difficult. And we keep it forefront in our mind to ensure the availability of appropriate and quality services for people. So, and the flexibility in those services too, that's an important thing, that we're able to keep the funding where the community need is. Okay, client satisfaction surveys. This is something that we've always done, and we are now intertwining this, I guess you want to say, with our results-based accountability, which is a feedback model that the county uses. Most county departments do. The Office for Aging will work with student interns to measure client satisfaction with services. And this will be used in our RBA initiative. Our office will be using surveys as a tool to collect data over a course of time to ensure our programming continues to be effective and is meeting the needs of our clients. The data can also be used for funding purposes and will be incorporated into our office's yearly budget. The collection is beginning right now. We just recently completed one survey, and we will be continuing this in 2022. Targeting, the Office for Aging continues to its efforts in targeting its services to underserved population, including non-English speakers and racial and ethnic minorities, particularly the Asian community. The Office for Aging will strive to maintain racial and socioeconomic diversity on its advisory committee, and also include older adults from all parts of the county. Outreach staff, it will continue to direct efforts to older adults of low income, those who are isolated, and those living in rural portions of the county. And we'll continue the efforts to the lesbian, gay, bisexual, and transgender older adults. So the next slide is really, I'm not going to go through each one of these points here, but we maintain a list. The staff, recognize some of the services or gaps in services in the county, in agencies, even though we are very heavy loaded in human services in this community, but there are always gaps that we come across through phone calls or clients that call us needing things or tell us that this is a struggle for them. So we keep a list of these unmet needs, we call them. It's just either in short supply or unavailable in the county. And we strive to put those unmet needs on our priority list when we're advocating for services. Okay, now into the budget. So this basically is a budget breakdown by funding source. Again, this is going to be a quick look at our budget. You can dive deeper into it if you go into that plan abstract. But it does go over what portions of our funding, our county funding, you can see the big blue piece is the county funding, and what is state funding, that's the big orange piece, and our federal funding is the gray piece. I'm having a hard time seeing it on my screen. And we also have interdepartmental funding that we receive from our local DSS. We do have grants that we bring in funding from, matching funds from contributed by subcontractors. So some of our funds that we subcontract out have to have matching funds from the subcontractors themselves. Contributions, those are just different contributions that are provided to us. They're a little bit different than a fee and client share, but the fees and client shares comes typically from our in-home care services. So but the biggest funding sources right there, you can see, are the county, state, and federal. Okay. And this just breaks it down a little bit farther and shows the comparison between 2021 and 2022. We will continue to maintain we have 28 different programs that we administer. We have 32 different contracts, 12 different subcontractors, and we have 22 funding streams. So this is just an overview of some of those funding streams put together. We have like 9 federal, there's 9 state, 3 local, and 1 grant line. And we have 4 different fiscal years. So our budget gets really, it's really interesting. But this, you can kind of see how we compare each year. We did meet our fiscal target for our county funding this year without any over target requests. And our budget does not look much different than it did from last year. So that is really it. And I'd love to hear if anybody had any questions for us, and again, please, feel free to reach out to us in any way, not just through our survey. We do have an email. You can email any of us. You can call our office and anyone can take down information or feedback that anyone has. Is there any questions?
So I'm not seeing any questions in the chat at this time.
Okay. All right. Is there? Thank you, Liza. Yeah. Well, again, there is opportunities, and as Karen mentioned, the survey will be kept up till Monday, November 1st.
Yeah, it'll be up through Monday, November 1st. I did put my email in the chat, so if anybody would like to just email any questions or comments or anything, you can do that directly as well.
Okay, great. Well, thank you all, and this will be on our YouTube page, so it can be shared to those of you that are attending right now. You can, it's recorded and it will be able to be shared to other people.
Great.
Thank you, everyone.
Thank you.
You.